Image of a nurse. Various perspectives and why it matters. When one says the word nurse, there are an abundance of definitions, preconceived notions, and experiences that run through a person's head. Today, we'll focus on society's assumptions of a nurse, the media portrayal, what nurses assume about the public's view, and nurses' own view of their image. In the end, we'll review why the image of a nurse even matters. American Society of Registered Nurses states, quote, "The public perceive a nurse as just someone who assists the public during and after treatment of the illness, assisting the patient in keeping up his personal hygiene, giving the medications as prescribed by the doctor, dressing the wounds when there is a need, and ensuring the welfare of the patient." With this research in mind, let's go over some of society's other assumptions. Nurses are less intelligent than doctors. Nurses have no independence from doctors in their work. Nurses are always female. Nurses see individual patients, explain, respond, and watch over. And that's from the American Society of Registered Nurses. Nurses' main role is just to care for patients. And finally, people become nurses to marry doctors. This, I can say, is not true. On a broader spectrum, when it comes to media's portrayal, the nurse's role and attitude is based on old stereotypes involving little to do with medicine. Nurses are publicized as sexy, shy, and feminine. In the journal article, The Nursing Profession, Public Image, Self-Concept, and a Professional Identity, it highlights how media portrayal rarely displays a nurse as an autonomous healthcare provider. A nurse is generally just the doctor's handmaid. Now we'll discuss nurses' assumption of the public's view. According to Takes, quote, "The results showed that overall, nurses perceived themselves statistically significantly more positively than how they perceived the public viewed them." This rang true when coworkers described how they thought the public viewed them. Beliefs expressed by coworkers were such as the generalized public cannot fully grasp what encompasses the role of a nurse. Society believes nurses make lots of money, and all nurses do is wipe butts and give medications. Although every nurse views themselves in a slightly different manner based on where they work, what their job entails, nurses come to a remarkably similar description of their own image. Some of the things that nurses mentioned were that they are caring, they're the eyes and ears of physicians, the backbone to the healthcare system, and they're sacrificial for the sake of patients. And finally, they're a patient advocate. Now, why does the image of a nurse matter? Poor public image impacts the nurse's attitude toward work. This is seen in Takei's article that work by nurses was actually decreased. They decreased their productivity when they realized how the public viewed them. It also impacts nurse recruitment, and that matters a lot. We always need more nurses. And finally, it impacts who patients go to. Patients want to go to a trustworthy professional. They want a clean and well-groomed nurse. They want an honest and empathetic one, and they also want someone who's knowledgeable. You don't want to be sharing these deep, dark things that could be possibly scary to someone who just can Google quickly on the internet possibly what it could be. They want there to be a deeper knowledge there. Despite the wide range of views on nurses' image, one thing remains the same. A quality, caring nurse is a one-of-a-kind human who faces victories and tragedies many cannot imagine.